Good evening, everybody. It's Monday night, and you're riding with the Road Crew. This is the Road to Liberty podcast on the Think Liberty Network, coming to you live from Omaha, Nebraska. I hope you're all staying safe tonight. Hope you're all staying healthy tonight. All right, the world is not in a good place right now. We are going through something right now that we haven't seen in a century, and a lot of people don't know what's going on. We're getting conflicting information every day. We need some info. We need experts to tell us what's happening. And that's why tonight I'm bringing on a longtime guest if you guys listen to the show for a long time, you know who I'm talking about, Dr. Kyle Varner. Welcome back to the show.
Hey, it's always good to be here. I always have fun on this show.
Absolutely. You know, I was sitting here thinking, who do I know that can talk as an authority on a virus, on a medical issue? I'm like, Dr. Varner, of course. Why didn't I think of that right away? I'm smacking myself in the head like, of course, our good friend Dr. Varner. So we all know what's going on in the world right now. Coronavirus, COVID-19 has spread all over the world. It hit China real bad. It's hitting Italy real bad. It's hitting the United States real bad. New York is feeling its full effects, it looks like right now. And there's a lot of the government is doing a lot of things to try to stop it. We don't know if it's going to be effective. So how dangerous is this virus right now? Like, how much should people actually be worried about this?
Well, people should be very worried. How dangerous it is depends on who you are and your individual health situation. And it depends on what happens over the next few weeks to a month in terms of what we are able to do as humanity, the human species, what the human species is able to do globally to try to put a lid on this. So let me explain. So if you are young and healthy, this isn't very dangerous, but I don't want that to be taken to mean that it's just a cold, because that's not true. There are young and healthy people dying from this. One of the most famous deaths was a 35-year-old ophthalmologist in China. He had actually been one of the first doctors to publicly report about this. He started posting on WeChat about a group of patients with a syndrome that was suspicious for a SARS-like virus. And the Chinese police actually brought him in and made him, under arrest, sign a statement saying that he had been spreading rumors. And later, as he was treating these patients, he contracted the virus and he died. Now, I'm 35 years old, so I'm very alarmed by that. Young people can die. It's just that fewer of them will than elderly people or people with medical conditions. And when we start seeing in the 80 years old plus demographic, people are dying at much higher rates. And so we're looking at 15-20% mortality sometimes. And when you get sick enough to get hospitalized, and we start saying, you know, we're looking at 50% mortality sometimes, depending on what their comorbidities are. So overall, right, mortality rate of the diagnosed cases around 3.5%. But we do think that those cases are not representative of all the infections. So it might only be 0.3% if we're diagnosing 10% of the global infections. We don't know the denominator right now. So that's hard for us to say. So somewhere I would say between 0.3 and 1.5%. That's not nothing. And when you have a virus that is so infectious and spreads so rapidly, these small percentages can start adding up to a lot of dead people. And that's what is so alarming. And so, yes, I think everybody should be very worried, because we are facing a very severe disaster all over the world right now.
So how does this thing spread? Like you said, it's a very contagious disease. I've been seeing a lot of information about how the spread is so much faster than the flu. One infected person can infect so many more than just your everyday flu. So how does it transmit from one person to the other?
So it's a droplet transmission is what the people who are looking at it tend to think right now. And, you know, this is all very early. Okay, but what droplets means is that it's coming out of your oropharynx, out of your airway, because that's where it infects, or it's affecting your lungs, your oropharynx. And so as you speak, or if you cough, or if you sneeze, right, it comes out on droplets. And so droplets spread out in the air, but the nice thing about droplets is they don't spread too far and they fall. And that's where people are getting the 6-foot rule, because we tend to think that your risk of contracting it via breathing gets a lot lower after you get 6 feet away. How long does it stay in the air? Again, not sure, 2-3 hours, maybe less. But that's not the primary means of transmission. The primary means of transmission is that those droplets fall onto surfaces. And also we get them on our hands because we're always touching our faces. We can't stop touching our faces. I did another podcast and I said, don't touch your face. And then I immediately touched my face on camera. I think I just touched my face right now. Anyway, so we're touching everything. It's what we do. Yeah, it's what we do, right? You walk into a building, you touch the doorknob. You go and sign your bill at the restaurant, you touch a pen that's been touched by 30 other people and not washed. You're touching things. And then we touch our faces, and that gets into our mucous membranes, and we get infected. So it's currently believed, and I think it's correct to believe, that the majority of transmission is happening by touching things. So, but that it is possible to breathe it into, but it's not something like measles where one person in, a giant theater has it, and just by breathing, a bunch of people in the theater get it. No, I think it's a little harder. Now, certainly in confined spaces, those droplets definitely can circulate more. So that's the concept of how it spreads.
So if you, besides just somebody coughing on you, if you don't touch your face, if you just resist the urge, right, you should have a good chance of not contracting coronavirus. I mean, not guaranteed, because people can always cough on you and breathe into the air and you can breathe it in. But the biggest thing we have to worry about is just touching everything around you and then absentmindedly scratching your eye.
Yeah.
Or something like that. Picking your nose. Don't do that either.
That's really difficult because in our culture, especially, we touch things, we shake hands, and we, we're signing things. It's very difficult. But yeah, so the key here: avoid touching your face. Wash your hands, and wash your hands some more. I mean, you can't imagine how often I'm washing my hands every day in the hospital. I mean, I just can't stop washing my hands, right? And that's what we need to wash our hands. Mm-hmm. We need to be careful about what we're touching. We need to, and the reality is that we just need to minimize our presence in spaces with other people. That's what we have to do. And it's a difficult thing to do, but that's the way we can minimize infection.
How effective are the hand sanitizers that you can buy in the store?
Well, they're highly effective. I think it's fair to say that if you sanitize your hands with one of those hand sanitizers, and you really sanitize all the surfaces of your hands. A lot of people don't do that. They just kind of put it on their palms and rub it around. No, you got to get it between your fingers, back of your hands. This area right here of your hands is very often missed when people are washing their hands. And so you kind of do this number to get these. There's, believe it or not, they have classes for doctors on how to wash your hands. And you're doing this and you're doing this. You got to get the whole surface of the hands. So I would encourage you to be liberal with the amount of hand sanitizer you use and make sure you get it everywhere. And that's you got to do a good job washing your hands.
Right. Elizabeth Huss wants to know: is a mask really essential?
Ooh, that's a good question. That's a hotly debated topic right now. So, is a mask essential? I think it should be considered essential. Unfortunately, the FDA is blocking the importation of masks right now. There are hundreds of thousands of masks sitting in ports, waiting for FDA inspectors, and Lord knows when they will come. And so we have a national mask shortage. And
wait, hold up. I haven't heard this. The FDA is blocking the importation of masks?
Yeah. So
Why would they do
is
that?
an incendiary word, but they have to inspect them when they're imported, and they can't be moved from their inspection facilities. They can't be unpacked and they can't be distributed. And there was an article yesterday in the Washington Examiner that was featuring the testimony of several whistleblowers that are basically saying we can't get the FDA to come, and we've got over 500,000 masks. We want to distribute them, and the FDA is the rate limiting step, and they're not coming. So that is the current situation. If you want to call that blocking, it seems to me a lot like blocking. If you want to just call it one more piece of the red tape that's constipating America's response to the crisis, that's another way of calling it. You know, we swim in red tape in American medicine, and the red tape is now strangling us. But to get back to the mask question, the CDC is recommending now that surgical masks only need to be used by like healthcare providers interacting with high risk patients that are being tested or have confirmed COVID-19 or other things. But there is a study out there published that took some smaller groups and they basically were studying the spread of influenza and how masks can limit the spread. And what they found is that at 50% of the people wearing masks, you saw a dramatic drop off in influenza outbreaks. And at 80% of people wearing masks, you saw a complete absence of the outbreak. And I'm not really sure about their methods, but this is a study that's being talked about a lot by doctors. If it were up to me, everybody in the hospital would wear a mask all the time when they're in a room with other people. It just makes sense that if you're talking and you have a mask on, that mask is going to catch a lot of droplets. They're not going to go spread out. The mask, especially once you get used to it, could actually prevent you touching your face as much. And while it doesn't, filter all the particles, it definitely is going to reduce the amount of particles that are coming in. So there's a role for masks, and I think there's an expanded role for masks. And I wouldn't be surprised if 1 year from now, America's culture has changed so much that we consider it impolite to appear in public without one.
This is...
Go ahead.
Sorry, go ahead. Yeah, this is something you see in a lot of Asian countries who've been dealing with like SARS outbreaks. You always see you never see videos of people walking around in a Chinese or Korean city. There's always somebody with a facial mask, right? It's not a social faux pas to see somebody running around with the mask. It's just an everyday occurrence. Whereas in the United States, you see someone walking with the mask, you're like, the hell's that guy's problem? Why is he wearing a mask? What is that all about?
Yeah, and I predict that when masks stop being scarce, see, right now, let's just be honest, we are holding on to our masks so that we have them when we're dealing with high risk people. We don't. That's just the reality, and the CDC's recommendations reflect that reality. But when masks become readily available, I bet the CDC is going to change their recommendations, and they're going to say everybody everywhere should wear a mask. A lot of countries are doing that, especially in Central and South America. I mean, they're saying, you go out into the grocery store, you better have a mask. It's obligatory. And I don't know that we'll go to that far in the United States by obligatory masks, but I think we will start to see, leaders recommending the use of masks, and I think that's responsible. I think the best available information we have says that they do have the ability to reduce the spread a little bit.
Yeah, when this thing first started popping up, I kept hearing doctors say that those masks aren't going to help you, right? That they're not going to do you much good, that there's no point in wearing them. Was that just so that people don't go out and buy all them up and there's none less for hospital workers? Or is that because they don't actually work? Like, why were they saying that?
Well, so I think there are a couple of reasons. And one was that was partially motivated by a fear of scarcity. Secondly, though, I think there's debate about it, right? Because you look at what can get through that mask and you realize the virus particle is small enough to just get straight through it. And so, there's reason to say like, hey, I don't know if this is keeping me safe. But the CDC says that I'm safe if I go into a COVID-19 patient's room with that mask and a face shield. So there's a contradiction here, right? They're saying the mask doesn't protect you, but they're putting guys like me and my staff of nurses and respiratory therapists in direct contact with confirmed COVID-19 patients, and they're telling us the mask will protect us. I hope the mask protects us. I really, really hope it protects us. We're not even using N95s for that. We're using N95s are masks that have rated to control much smaller particle sizes, but those are being reserved for use only when we're doing aerosolizing procedures that can really stir up those particles in the air, like intubation or like nebulizing therapies. So we're in a tough situation with regard to that.
Now, is that just because there aren't enough of them to use them all the time?
There aren't enough of them. In my hospital, we've got bins all over now where we're supposed to take our disposable masks. We're supposed to untie them very nicely, make sure they're not like soiled with mucus, and then we put them in there. Those are then being autoclaved. So they're being basically put in a bag and put in an autoclave that sterilizes surgical materials, and that's getting ready so that they can redistribute them so we can use them again. And that is certainly better than nothing. But what would be much better is if the FDA would let those masks in.
Yeah, it sounds like it. I mean, what it sounds like is probably some kind of law that sounded good under normal circumstances, but now that when you need thousands and thousands of these masks and you need them really quick, what they're doing is following procedure. They're following the letter of the law. They're going along with what they usually do, which is yeah.
Right. So
that's probably fine in a normal situation. It doesn't kill people.
Right. Well, I think that these procedures that the FDA has implemented have tremendously slowed development of new therapies. I think they've tremendously increased the prices, and I think it does kill people. We're just really seeing it now, and it's disturbing. It's very, very disturbing, and especially that they're not easing up right now. But yeah, there are a variety of factors that led to this shortage. But I think the central part is that we just don't have a free market in personal protective equipment, and so we're suffering now because of that.
Right.
It's hard enough to stand up new factories to make stuff, but when you've got like regulations this thick and approvals, it just makes it even harder.
Have you seen any letting up when it comes to that red tape? Like I keep hearing people talk about, we're letting up regulations, we're getting rid of them, we're making things easier. Have you seen any of that in your practice, or is that just so much hot air?
Yeah, every state with a major need has basically publicly said, like, we are going to allow people to come in from out of state and practice. So New York, Colorado, California has got some. If I wanted a medical license in California, a year ago, it would have taken me an entire year and $5,000 in different fees to people to prepare documents and hunt down this and that. And now I could probably get it in less than 24 hours. Same with New York, same with Colorado. So they're doing things, right? They're lessening regulations, but not to the extent they need to. Just as an example, right? There's a company, I want to say it's out of North Carolina, that's got a very good test for the coronavirus that they're shipping overseas. And I want to say they're getting results in like 45 minutes. There are multiple companies that they're shipping it overseas, but it's not approved to sell in the US. So they created an expanded access pathway, emergency approvals for some tests. And that's how we finally are starting to make a little headway on testing, although we're still woefully inadequate in testing in the United States. We started to make headway. We only made headway because they finally said this is so urgent we can't follow usual procedure, but they waited for months and to do that. They really clung to their red tape. I don't know what we're supposed to be so thankful about Donald Trump deregulating the economy, because my God, red tape is still precious to the bureaucrats even under Trump.
No, absolutely. Without red tape, they wouldn't have a reason to exist. Exactly. Right. So of course it's precious to them. Yeah. That's the whole reason for having a job.
Exactly.
So we hear a lot about flattening we hear a lot about flattening the curve, right? Like this is the big thing that we're working towards, that we're all social distancing and quarantining ourselves inside our home, all for the goal of flattening a curve. Now, my concern is, say, and we've been hearing rumors of like a countrywide 2-week lockdown to get control of this thing. My concern is that say they do something like that, right? And then after 2 weeks, they let everybody out, and this thing just spikes again because everyone's out and about infecting everyone again. So how effective do you think all these measures are in actually reducing the number of people who get infected?
All right. We don't know for sure how effective they are because they haven't been in place long enough to give us that number. I am hoping in the next 5 to 7 days here in my state in Washington, we start seeing reductions in the number of new cases a day. I go every morning, worldometers.info/coronavirus. That's the best data aggregating site I've seen, and I'm just looking at every day. There are like more new cases than the previous day. And I'm hoping in 5 to 7 days we see that trend reverse and there are fewer new cases. I think it might have finally reversed in Italy, but it's still a little too soon to say for sure because, you know, there's just day-to-day variation, and I'm not so sure that the reductions we've seen in the last 2 days are going to continue, but I'm hopeful. So here's my perspective about flattening the curve. Okay, we got to do it right now. And we've got to do it because we're on the verge of a situation where we're not going to be able to provide hospital care to the people who need it because our hospitals are going to be full and we're not going to have enough ventilators to take care of people. And our hospitals are going to break down in terms of get overwhelmed, and people, not even just coronavirus patients, but you have a heart attack, you may not be able to get treated. You have a bleeding issue, you may not be able to get treated. You know, there are a lot of issues like that going on. So we've got to reduce the number of infections right now so we don't get overrun. Because if we get overrun, a lot more people are going to die. Then you're absolutely right to worry. Well, when we ease up on the restrictions, it'll spike. And by the way, the restrictions are causing tremendous pain all around the country, economic pain that is also going to manifest itself as suicides, as drug overdoses, as all kinds of things. You know, Colorado is making a big mistake. They shut the liquor stores. Well, what's going to happen to all the alcoholics who go into DTs? So the fact of the matter is these measures are hurtful. And I also think necessary right now, but I don't want them to continue for very long. And there's only one way to ease up on these, which is to dramatically expand the testing capacity in the United States. The only group that can do that is the private sector. Because the private sector's got to be the ones who are set free to dramatically expand the testing so we can run millions and millions of tests every day. Because the only other thing we have to control this virus, besides lockdowns and social distancing, is massive testing and contact tracing. And if we can massively test, as South Korea is doing, test, and then when it comes positive, somebody calls that person, hey, you were positive, go into quarantine. And by the way, let's talk, who did you have contact with over the last 7, 14 days, whatever we figure out. And then they start contacting them, hey, you had a positive contact, get in and get tested. That's the way we can also flatten the curve. We can really control it and much more effectively. Now, under that, what I just described, yeah, it wouldn't be possible to have basketball games with 50,000 people in a stadium. It wouldn't be possible to run the movie theaters or, things of that nature, but it would be possible for the 95 or 99% of our economy to go on. And so that's what we need. We have the private sector can offer a solution where these things aren't necessary. And given the freedom to do so, they could ramp up to that testing capacity in 2 weeks. I have no doubt. But there's red tape that's preventing us from doing that.
Yeah, and this is one of the frustrating things when talking about this virus is people forget, right, that economic collapses also cost lives. Everyone's focused on the disease, everyone's focused on the virus, and they should, right? That's the big crisis we're dealing with right now. But I'm hearing people talk about how we need to go on lockdown for a month, 2 months, 3 months, and I'm just sitting here thinking, who's going to have a job after being locked away for 3 months? right?
Right.
How many people are going to be in abject poverty after that, right?
Yeah.
So this thing has to be dealt with before that becomes a reality, because if that
Exactly.
happens, we could see a depression that dwarfs the Great Depression.
Oh, absolutely. I would just make the point to those who are criticizing the current measures for their economic problems that the current measures and measures that are far more draconian are inevitable. And they're inevitable because a pandemic of this nature creates tremendous fear. And, as the cases mount, as the hospitals get stressed, the fear ratchets up and ratchets up and ratchets up. You cannot just postulate a world where politicians learn economics and behave rationally always. So the question really is, like, we've got to do something to get this under control, because if we don't, the fear will keep ratcheting up and there will be shutdowns. I just read an article from the Wall Street Journal that all the major airlines are basically preparing to voluntarily suspend passenger flights in the United States. And I believe within a week, we won't have passenger flights anywhere. We won't have domestic passenger flights. I don't know how long that'll last for. And that's not even with any government action. That's a result of the fear. That's, by the way, rational fear. You should not fly unless it's essential. I canceled a lot of trips of my own. But what I'm saying is that my governor just imposed a shelter in place order. Basically, it's not really. You can go to the grocery store, but he's shut down most businesses. Only at the grocery store, the gas station, the hospitals, doctor's office, pharmacies, these kind of things. It's all that's open. People are out of work. It sucks. It's horrible. But it's not like he really has any choice. He could delay it a little bit, but eventually he'd be basically forced to by the huge level of fear. So I'm not too worried about arguing whether they should or shouldn't do those things. The point that I just keep making is we've got to free the private sector to do massive testing, because it's the only realistic way out of this. The libertarian Facebook isn't going to get their way by posting their very strident opinions all over like they do. The only way out is massive testing.
Right. Do we know why this thing doesn't seem to affect young children like a normal flu would?
So there are theories. One of the theories is there are these angiotensin receptors in our lungs that the virus uses to enter, and they think that children may not have as many of those or as much density of them. And then there's their immune system doesn't react with what we know as what we call a cytokine storm, which is happening toward the end of the disease process and end up killing people. Those are the two kind of theories, but all we have right now are theories. It's very good. I'm very glad that children aren't being affected by this, but the children are also these asymptomatic or minimally symptomatic vectors of disease, and it's unfortunate because they're so minimally affected that oftentimes, there are a few children who have been severely affected, but they result in infections to adults who are more vulnerable. I see a comment here from Elizabeth who asked, am I seeing severe cases, or is this just like a
Let me
flu?
bring that one back up.
Yeah. I'm seeing intense cases. Okay, I'm a hospitalist though, so that means I work exclusively in the hospital. I don't see people unless they're sick enough to be in the hospital. But I'm seeing severe cases, and I believe very much that I'm going to start having patients die on me very soon. Okay, so severe cases needing to be on a ventilator, needing to be on life support, or you would already be dead. And the process that when somebody goes through when they have this severe illness is called ARDS, ARDS, acute respiratory distress syndrome. But it's just this massive inflammation of the lungs that the virus has provoked. And it becomes very hard to oxygenate those people. And I've been studying up on the ventilator protocols for the life support machines. That's not my main focus of critical care, but I have done a lot of it, and I believe I'm likely to get called into doing that again, just because, of all the doctors with the different skills out there, there's a certain subset of us who know how to run a ventilator and have done it. And they're gonna need that more than they're gonna need my rounding on the cardiac ward, which is where I spend most of my time on a normal day. Anyway, the point I'm making is that an ARDS patient is hard to ventilate and get oxygen to. I shouldn't say oxygenate, not ventilate. Those are different things. But we actually have to put them on their face. If you see me on Facebook, sometimes I talk about if you've never seen a young person face down on a vent. And what I mean by that is something we actually have to put people face down. We call it proning. And that's because it changes the hemodynamics in the lungs a little bit and we can get them oxygenated a little better. But it's actually really hard to manage a poop coming out of their mouth when they're face down. So we have special pillows, and in some centers, there are special beds. And then there are things called ECMO, which is a way we take blood out of the neck, oxygenate it, put it back in the neck. That's venous ECMO. So there are other things we can do, but I mean, we're talking about people who would die without these, and then we're talking about limited availability of these. And so it's scary. I have never in my career had to make the decision about whether I would intubate someone or not, like whether I would. I mean, I've made those kind of decisions about like, hey, do you really think this is what you want because you're not likely to survive and it's going to hurt a lot? And we talk to the patient about whether it's right for them. But I've never had to say, I got this person and I got one vent. But we're looking at that. We're looking at that as in our future. And I hope and pray, I'm an atheist, but I hope and pray that I do not have to make that decision, because that's just a decision that is going to scar me for a long time. It's going to really hurt to make that decision. And so I really hope I don't have to.
Right. Yeah, and this is sort of the situation that Italy has found themselves in, because their doctors there are having to make these decisions. And
they're not intubating.
People come in, they have limited resources.
So you're over 60 or over 65. Hey, both my parents are over 60. My grandmother's 80. If you end up on a vent, you probably still have about a 50% chance of survival. So you're cutting those people's chances of survival by half because of the intensity of the pandemic. It's why it's so important that we all cooperate. And I think it's a moral responsibility for every individual to realize that you don't want to be a vector to get somebody sick. You don't want that on your conscience. It's wrong to do. We have to behave prudently to take care of our fellow human beings. I'm not trying to be a statist here. I'm trying to be a human. We got to be responsible to keep our fellow human beings safe.
Okay, so what would you say to libertarians? I see this a lot that libertarians do. They don't take it seriously. They're not in the affected age group. They don't have any medical conditions. They're like, I'm good. Why should I social distance? Why should I bother with any of that? If you're old, stay inside. Why should I bother? So what would you say to them?
All right. Well, have you ever been in Latin America on New Year's Eve? I'm going somewhere with this, I promise. But if you are in Latin America around New Year's Eve, there are signs and radio commercials and TV ads all over telling people don't shoot guns into the air, right? Because it's a tradition in a lot of these places. Hey, it's New Year's, it's midnight, bang, 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 right? Because it's a celebration. And people think, I'm shooting the gun in the air, I'm not hurting anybody. But you know what happens? Those bullets come down somewhere, and you could probably shoot 10,000 times in the air and not hurt anybody. But eventually, there's a little risk, right, that you're going to hurt somebody. And what do I call it when someone shoots a gun in the air? I call it an act of negligence that endangers other people, and it's wrong. And it's a violation of the NAP. To behave negligently is to violate the non-aggression principle. And that's true if you shoot a gun in the air. That's true if you drive drunk. That's true if you drive recklessly. And it's also true if during a global pandemic that potentially threatens millions of lives, you go about your daily business without caring. Because every single person can transmit this disease without knowing they are transmitting it. Which means if you go down to the bar to have a beer, and you touch the bar, and you touch your buddy's shoulder, and you put the glass up for cheers, every time you do that, there is a risk, albeit a very small one, but there's a very real risk. You are an asymptomatic viral shedder. You're shedding the virus, or that you get infected and later bring it back to your family or bring it to your place of work if you're at an essential workplace. We have to, as human beings who live with other human beings, we have to accept that we can't be negligent and endanger other people. So I would argue that as libertarians, the number one most important thing in our philosophy should be personal responsibility. We do the responsible thing. We don't need the government to tell us to do it. We just do the right thing because we know that human beings, uh, by and large, are people who do the right thing because we care about others. And I think those people who are screeching about how they don't like the government and then refusing to voluntarily behave like responsible people and going out and recklessly endangering others are really undermining our case for libertarianism. The best case you can make for libertarianism is with your behavior. And your behavior has to be responsible and respecting the rights of your fellow human beings. And that's what participating voluntarily in social distancing means. It means respecting the rights of your fellow human beings, not to get infected and potentially die with a deadly disease.
Absolutely. And this I've seen this a lot. And it honestly pisses me off, especially when anarchists do it, because they're the ones who are always saying, we don't need government. We can act responsibly on our own without the need for government to tell us what to do. And here's your opportunity to do it. Here's your chance to act like a responsible human being and a responsible adult, right? Because we don't know what we can do to prevent ourselves from spreading this thing. Wash your hands, use hand sanitizer, keep 6 feet distance from people. Don't go about your normal day as though nothing's happening. Right. And yet I see so many anarchists saying that I'm not going to do any of that. If you government, they told me not to do it, so I'm going to do it. Like, no.
Right.
This is your chance. This is your chance to practice what you preach, to put your lofty ideals into action, right? And you don't need government to tell you to do it, but they're refusing to do it out of pure spite, and it's so annoying to see people do
it's antisocial is what it is, and it shows a disregard for the rights of others, and it just goes against libertarianism as an ideology. It goes against everything we believe in as libertarians. If we don't personally respect the rights of others, how can we then expect the government to respect individual rights? We have to start with our own behavior and act correctly ourselves.
Absolutely. One last question. Like me, I'd be considered a person that provides a vital service. I'm a trash collector, right? That's what I do for a living. People's trash needs to be picked up, because if people's trash not picked up, there's a whole other list of sanitary issues that you start dealing with. So what can I do to protect myself and protect my family when I come home to them every day?
Absolutely. Such a good question. So I have the same thing, right? Because I come home to my family every day and I work in a hospital. So, but let me talk about what for you first, and then I'll talk about what I'm doing for me, because I think our risks are like orders of magnitude different. Okay, you're working on a crew, probably what, 3 or 4 guys or 2 guys, or what? How does that work?
It will usually, how it works for us, there's a couple people that work in a 2-man crew, but most people work solo by themselves. The only time where they actually work with other people is when we come together in the morning and then disperse to our different routes.
Okay. Yeah.
Right.
So I would say, when you come together in the morning, you should be 6 feet away from others. Okay, that would be number 1. Washing your hands. It would be not hanging out. I don't know if if on a good day you show up and have coffee with your coworkers, that kind of thing, before the meeting or that kind of thing. In fact, I would say, if I were advising your company, or I would say, if you guys have like some meeting where everybody gets in a room and talks, cancel that. Just give people their assignments posted on the door outside, and try to avoid getting all those people in one room. It definitely, hand washing and physical distancing are the 2 most effective things. Now, you're in the truck together with your colleague. You need to not go to work if you're sick, and your colleagues need to not go to work if you're sick. I would tell the employer that what you need to do to make this feasible is that you need to make sure that people know they will be paid if they don't come to work because they're sick, because otherwise you run the risk of people hiding their symptoms because they want to get paid. It's a real thing that studies have shown that. So the employer, that's on the employer. They have to figure that out. But for you, it's, check your temperature in the morning. If you have a cough, if you have a fever, if you have a sore throat, or if you have shortness of breath, those are the red flags that you shouldn't come to work. And definitely, if your coworker has those things, you should say, hey man, we can't be working together because you have a cough, or you have a sore throat, or whatever. So there's that kind of communication with your coworkers. There's washing your hands and washing your hands and washing your hands. And then I would definitely be using gloves all the time when I'm touching the trash cans put out by the different people in the city, right? Because you probably already do that, I'm guessing. I think your job,
we wear gloves
I
all the
think your
time.
job is a fairly low risk of exposure job of contracting the virus, just compared to all the things, because you're not in like a super high, close proximity to lots of sick people. Like probably the highest risk job might be ophthalmologist or ENT surgeon, because they're getting like right here in people's faces for long periods of time, because that's what they have to do their job, and they're working in places where more sick people show up. And that's been borne out, at least in Iran. We've seen a lot of EMT and ophthalmologists dying of COVID-19. And we've seen that in China, obviously, the ophthalmologist we talked about in the beginning of the show. Now, for me, it's much different, right? Because I have to go to work, be face-to-face with sick people, and then come home. So, and I live with my parents. Sorry, that's kind of embarrassing, but I do. Anyway, we basically split the house in two. So I use one entrance, they use the other entrance. They stay in their side of the house, I stay in my side of the house. We have kind of a little no man's land, and my parents have the kitchen, so my mom cooks. She puts the food in no man's land, then I go into no man's land and pick it up. And right now we're trying to figure out. I'm not going to show you, but like just over here to my left are a bunch of dishes, because I can't quite figure out what to do with the dishes, because the kitchen is not my part of the house, and I've touched and eaten off of these things. So I'm still trying to figure that part out. I might like take them outside or something and wash them that way with the hose or something. I don't know. But I will not, under any circumstances, put my family at any kind of risk. I'm physically separating from my family, and that's what most doctors I know are doing. We're physically separating from our families. My grandmother, I haven't been for like almost 4 weeks over to her house. I'm really close with her. So like every day I'm in town, I usually, or every other day I go and see her, like on my way home from work or whatever, stop and see how she's doing or whatever. But I haven't, I text with her now, but that's painful. That's difficult. She's 90. I know I'm not going to have her for a long time, just due to her age. But I'm also definitely not going to be the guy who infects her and kills her. So for the duration of this crisis, I can't see her, and that's really hard. But that's what we have to do to be responsible people. This is hard for everybody.
Yeah,
It's not just hard for me.
Mercedes suggests using paper plates. That might solve your dishes
we have
dilemma.
started using some paper plates, so I do have some paper plates here, but we don't have like paper soup bowls in the house and stuff. So I have a lot of. But you're right. I'm gonna use more paper plates. I have to.
All right, so we're running up on time now, but do you have any more advice for people or anything else that you want to say about this virus before we say goodbye?
Medical advice, I think we've covered it, other than maybe telling you about Plaquenil, right? A lot of controversy. Is that just hydroxychloroquine or chloroquine, the malaria drugs? Are they going to work? So I prescribe them to patients in the hospital. I don't know if they work for sure. Nobody knows, right? The preliminary data is really promising that they could reduce severity. There's a clinical trial where doctors who've been exposed can enroll, and half of us are going to get the hydroxychloroquine, or half of us are going to get a vitamin, and we're going to see what the outcome is, right? Because you got to do these trials in order to know the answer. But if I get infected, I will move mountains to get Plaquenil for myself. And I would advise anybody who has been infected to talk to their doctor about getting Plaquenil. Now we're talking about a 5-day course of twice a day. So we're talking about 10 tablets, right? We have a national shortage. I mean, it's a really acute shortage. And there are people who take this medication for rheumatoid arthritis, lupus, and other autoimmune conditions. And if they can't get their medication, they're going to really suffer. Now, factories are trying to ramp up, but again, we're going to have problems because of all the regulatory red tape. But my hope is that we're going to ramp up production, and very soon it's going to be available widely. At which point, given my unique risk, I will start taking it on a daily basis for the duration of this outbreak. But not everybody can make that decision. But if you get infected, talk to your doctor about Plaquenil, plus or minus azithromycin. And then that's really the most important thing. And then also, if you get sick, your contact with your doctor should be via telephone or video. You should only go seek in-person medical care if you have shortness of breath or other reason to feel you might need immediate medical attention. Don't go to the ER unless you need to. And people have been in here in my town in Spokane, people have been really respecting that. We've seen our ER volumes drop. And it's because people are not coming for silly reasons. They're coming when they really need us. And so we've seen the volumes drop, but the severity of disease that we see in the people who do show up is much higher. And I appreciate that people, people have a sprained ankle, they are not coming to the ER. And thank you, because we need those resources for people who have much more severe problems.
Absolutely. And this is something that's helped my family out. If there's a nurse's hotline in your area, use that first instead of going to the doctor. Right?
If we're talking about that, let me give you guys some resources. Teladoc.com, Wellvia, MeMD, 1-800-MD. These are all telemedicine companies where for a small fee, less than $50 usually, you can get connected with a doctor who can prescribe medications for you, can do a lot for you. You can get video exams, and you can get most urgent issues dealt with. And if you can't get the issue dealt with, then they're going to get you hooked up with somebody who can see you in person. So this is a really great way. It's more convenient, it's lower cost, and it's in most of the cases, I work for some of these companies in my spare time. It's not something I do on a regular basis, but in most cases we can get somebody squared away over the phone or video conference, and they don't have to ever go in, and so it's really convenient. But in this case, it's life-saving. So use those kind of services.
Absolutely. Well, we're out of time now. Thank you so much for coming on the show. This has been very informative. Maybe we'll have you back on sometime in the future if this thing gets any worse. Or you know what? If it gets any better, maybe we can discuss that and why it's doing that. Hopefully that's the case. Hopefully this doesn't go on
eventually
for too long.
Better. When I can't predict, but eventually this will get better, and eventually this will be nothing but a really, really bad memory that scars and shapes our society in ways we can't even comprehend right now. But eventually it will be better.
We're going to get through this, everybody. We'll get through this together. Just be smart and stay safe and stay healthy.
And stay home.
All right? Right. Stay home. This is not the bubonic plague. This is not a world-ending event. If we stay smart, we can all get through this together. Thank you so much for coming on the show, Dr. Varner.
Hey, thank you so much, Nathan. I really appreciate the invitation. It was a great conversation.
Absolutely. All right, everyone. Remember, the website is think-liberty.com. Check that out. Remember to subscribe to us. Remember to like the Facebook page where you'll see these episodes live. All right, everybody. Good night. Have a good one, and stay home.